My name is Jiana Banda. I come from Lusaka, which is the capital city of Zambia, one of the countries in Southern Africa. I was diagnosed with liver hemangioma sometime in May, and I was advised that I needed surgery outside the country. So from there forth, I started searching to see where I can have this surgery done outside my country. That's when my company recommended Wockhardt, which is in Mumbai, central Mumbai. That's how I came to know about this hospital. I was told that the doctor who was going to do the surgery would be Dr. Rajeev Joshi. Well, so I started planning to come to India, and I arrived in India on the 14th of November. Well, when we arrived, I must say that I was very impressed with the Wockhardt welcoming that they gave to us, because I expected maybe them sending a driver to come and pick us up, but to my surprise they sent a doctor, which is very professional, because it makes a patient feel at ease to know that the person that is picking you up is a doctor, which was an excellent thing to do for Wockhardt. When I got to Wockhardt, looking at the reception that we got from the people, they made us feel at home, and it's like they assured me to say that everything will be fine. So it's like all my worries were cut off immediately I got to the place. But it's human, and a day before my surgery, I was still, a lot of questions were going through my mind. Will it be successful? Are the doctors going to do a good job? But I thank God that He used the doctors, and the surgery was successful.
This patient, Ms. Jiana Banda, a 31-year-old female from Zambia, was referred to me with pain in the epigastrium and a lump in the epigastrium for about 6-month duration. On subsequent investigation like a CT scan, she was diagnosed to have an exophytic hypogiant hemangioma in the left lobe of the liver. Hemangiomas, although the most common benign tumors in a female patient, exophytic hypogiant hemangioma is an extremely rare possibility. And this was a patient who is a flight purser with the Kenyan Airways. She flies regularly, she's more prone to trauma, and these exophytic hemangiomas normally have a tendency to rupture. After subsequent investigations and fitness from my physician colleagues, it was decided we proceed with surgery. She was more or less convinced with my treatment plan. Fortunately for us, everything went as per schedule, and I was able to discharge her within a week of her surgery, and she flew back in fact to her own country within 10 days of the surgery.
So after the surgery was done, I was put on a diet. That was a day on liquids, and I started taking solids on the second day. So they made sure that I was pain-free. They gave me the prescribed drugs that helped me not to feel the pain. Services offered by all staff was great. I was really amazed at the profession that all the staff showed. When we arrived, we were put in a private room, which was very great, and it made me feel at ease. And I must say that starting from the cleaners, they show they are professional when they are handling patients, to the nurses and the doctors that gave a 24-hour service. The nurses were there to make sure that I was given the attention that I needed after the surgery. It was a 24-hour service. I want to give a big thanks to the Wockhardt staff, starting from the doctors, the nurses, and the cleaners. Now that the surgery is done and was successful, I'll be going back to my country. And I want to encourage everyone out there who has faced the same problem like what at first, not to hesitate, but to contact Wockhardt Hospitals.
And I think at Wockhardt we talk about life wins. Here's a case where the team won.